The admitted temporary fix of current therapies. When asked, most cardiologists will admit that bypass surgeries, angioplasties, and stent replacements rarely result in a permanent solution. They know that arterial blockages will continue to progress. This is often the case for three reasons. One, the source of vitamin C depletion is not treated. Two, the amount of vitamin C ingested by the patient usually remains at the original insufficient levels. Three, the vitamin C does not adequately penetrate into the most deficient areas of the arteries. Several years ago, a close friend had a Y stent installed in his seriously occluded coronary arteries. Because there was continuing issues because there were continuing issues with his heart and the need for additional stenting over a short period of time, I recommended the removal of his only root canal treated tooth. His supplementation regimen was one of the best I had ever seen, yet it was not until his root canal came out that his chest pains stopped and his blockages stopped their rapid progression. It was only then that his high quality supplementation, which included 9 grams of liposome encapsulated vitamin C per day, were finally allowed to do their job. At his 5-year checkup, the cardiologists were totally flabbergasted that the stents were as clean as the day they were placed. Certainly I was pleased, but not at all surprised. They were clean because the vitamin C deficiency in his arteries had finally been resolved. Cures result when root causes are eliminated, not when symptoms are treated or suppressed. In the same way that putting a new pipe around an old blocked pipe under your kitchen sink will not clear the blockage, treating arterial blockages without addressing the underlying cause, low vitamin C levels in the coronary arteries, will never provide a permanent resolution. The blockages will continue to worsen. Cholesterol and vitamin C deficiency. For decades, traditional medicine has promoted cholesterol as a primary villain in coronary heart disease. Granted, multiple trials have shown that a decrease in cholesterol levels decreases the incidence of arterial blockages and heart attack. But additional studies show that arterial blockages will start and grow with a vitamin C deficiency alone, and the total absence of cholesterol elevations. Serum cholesterol levels increase with a vitamin C deficiency. Excessive cholesterol depletes vitamin C. Vitamin C supplementation lowers serum cholesterol, even with a high cholesterol diet. Vitamin C supplementation protects arteries from plaque buildup, even in the presence of high serum cholesterol. These studies add further proof that vitamin C is essential for maintaining the health of the coronary arteries. The buildup of cholesterol-containing plaque is simply part of the body's response to a weakening of the arterial wall initiated by a lack of vitamin C. In the presence of a continuing deficiency of vitamin C, a progressive arterial breakdown occurs that triggers further formation of vessel-narrowing plaque. High blood pressure and vitamin C deficiency. Although not assigned the primary role in the cause of coronary heart disease, high blood pressure is seen as a very significant risk factor for the development of arterial disease, and it is known to speed up the process. Additional studies show that vitamin C deficiency can cause and worsen high blood pressure. Vitamin C supplementation lowers blood pressure of hypertensive patients. Regular and sufficient vitamin C supplementation is required to maintain the optimal collagen content in blood vessels. Maintenance of arterial integrity in the presence of elevated or even normal blood pressure requires optimal quality and quantity of collagen in the artery. High blood pressure is not something to ignore. It can be very dangerous when sustained over time. However, multiple studies show that adequate levels of vitamin C lower blood pressure and protect the coronary arteries from damage resulting from excessive pressure in these vessels. Diabetes and vitamin C deficiency. Studies show that diabetes is a well established risk factor for coronary heart disease. The relationship between diabetes and atherosclerosis is so strong that 2 out of every 3 diabetics will die from coronary heart disease or stroke. Many other studies highlight the close interrelationship between vitamin C deficiency and diabetes. Here's a small sample. Vitamin C is involved in the synthesis of insulin. Vitamin C plays an essential role in regulating the release of insulin. Diabetics have greatly reduced plasma levels of vitamin C. High blood sugar limits cellular uptake of vitamin C. Low serum insulin limits cellular uptake of vitamin C. Diabetics have a much greater incidence of advanced periodontal disease, another risk factor for increased risk of heart attack. A severe deficiency of vitamin C is always seen in the inflamed and infected gums of advanced periodontal disease. Regular and sufficient vitamin C supplementation is extremely important for the optimal treatment of diabetes. The continual and severe vitamin C deficiency caused by diabetes is responsible for most of this disease's negative impact on the body. In combination with the increased inflammation and elevated blood fats, like cholesterol, typical in diabetes, this critical deficiency of vitamin C in blood vessels greatly accelerates the development of arterial blockages. The detrimental health impact of diabetes is not only compounded by a vitamin C deficiency, but the disease itself greatly adds to that deficiency in the blood and tissues. This reality underscores the diabetic's enhanced need for large doses of vitamin C every day. Conclusion.